one of the issues that we've been covering, right? One of the issues of this election that has everyone talking, and all of us should be concerned. Like, this issue that I'm about to bring up right now is an issue that I don't care who you are. I don't care how old you are. I don't care where you were born. I don't care about what language you speak or what's your native tongue. I don't care about what kind of shoes you like. I don't care what kind of programs you watch. This topic I'm about to discuss now with my guest is a topic everyone should be concerned with. We're talking about health care. Everybody got to be concerned with health care, because I don't care how old you are. You can get sick. And I don't care how fit you are. Somebody you love may develop an illness or be born with a condition and need medication or need treatment. So this issue transcends everything. There is nothing more important than health, because without your health, nothing else matters. On the topic of health, I have my new friend, here tonight with me, Mr. Jeff Day. Give it up for Jeff Day.
What's going on, Tim Black? Thanks for having me, man.
Man, thank you for being here, brother. Look, man, I'm sorry for keeping you on hold. I was just working my butt off, Jeff, trying to get out this information, man. But, man, thank you so much for making time, brother, and thank you for being here, man. Jeff, what do you know about healthcare, man? What's up?
Well, Tim, I have been a nurse for 15 years. I've worked in administration. I've worked in critical care. I've worked in the emergency room. I've been kind of all over it, and got, insights from all avenues. I've been in management as well, so I've seen that side. So I've learned a lot over the last 15 years about everything that's wrong with our healthcare system right now.
Man, hey, look, man, thank you so much for bringing that level of experience with you. And it sounds very comprehensive, man. And Jeff, man, what do you see? Like, look, I know that's a big question, but what do you see as being the number one issue concerning why we can't, with healthcare that we need in America? Like, if you could only get one thing, what would it be?
I would remove the insurance companies yesterday.
I love it, man. I love this guy. Yeah. I like him already, y'all. I like him already.
I mean, really, if you look at the insurance companies and the for-profit mentality of healthcare, that's what's broken right now. You go back to the Republican, and I don't want to get into party politics, but the Republican argument against Obamacare, which has been a failure in my eyes, was that the insurance companies shouldn't get between you and your doctor. Like, you and your doctor should make your healthcare decisions for yourselves. And unfortunately, that's exactly what's happened. 2 years ago was when I worked in the emergency room. And the doctors see you, the nurses take care of you, and they make a decision. Are we going to send you home, or are we going to admit you to the hospital? This used to be a decision made by the doctors. Well, now we have case managers and social workers running around the ER because they have to get approval from the insurance companies before the physician can even admit you into the hospital in most cases. So the doctor could want to admit you, think you're sick enough to stay in the hospital, but the insurance company can decline it. So you can either opt to pay out of pocket or go home, even though you and your doctor think you're too sick to do so.
Wow.
Yeah,
wow,
exactly.
Brother. That's bombshell stuff. You know what? I think a lot of people haven't had that experience yet, so that's why they're so quiet on the issue. Like, I personally have not experienced that. But you mean to tell me, if I go into the hospital right now and I think something's wrong with me, and my doctor thinks something may be wrong with me, that there can be some guy in a suit or a woman in a pantsuit can say, no, he has to go home unless he wants to pay for it himself?
Well, yeah. So the case managers work with generally third-party companies that look over your chart, your case file, and they work through as third-party companies with the insurance companies and the hospital. So the third-party companies look over and they say, yes, we think this person will get approval from their insurance companies, or no, we don't think they will. If it comes back no, then there are approval processes that go through it, but then you're extending the length of the stay in the ER when you got a bunch of people in the waiting room waiting hours and hours just to be seen. So that's a hold up. If they say yes, of course you're fine, but then you got new 23-hour observation units, which aren't reimbursed at the same levels as inpatient units. So if you're in the ER and you just have to stay there overnight because they think maybe you have an appendicitis, or maybe they think something really bad is going on, they want to watch you overnight. Like, even Medicare, you're only looking at 80% reimbursement instead of 95% reimbursement if you're admitted as quote unquote inpatient, which is something that generally requires 2 or 3 day stays in the hospital. But I mean, everything is about money right now, and that's why the whole system is broken. Why aren't we worried about the people instead of the dollars and cents that are going to the middle management and the administrators for these insurance companies?
I get it. So the administrators are really not there to make sure the medicine is done in the best way, but more so to protect the hospital from racking up bills, or to lower cost, I should say, for healthcare in general.
Right, because if you look at it from the hospital point of view, they have to pay for services, they have to pay for the nurses, the doctors, everything. So if the hospital doesn't think, or if they're told that the insurance company isn't going to reimburse the hospital for their costs and services, then they are more inclined to decide that you really don't need to be admitted, that you don't need to stay in the hospital, and they're going to send you home, all over dollars and cents.
Wow. Wow. Is there any type of incentive to administrators to say someone is a little bit better off than they may be in reality? I don't know.
No,
Okay.
I've never seen that. What I would actually say is the
Or should
providers.
I'm sorry, Jeff. Let me put it this way: in order to cut costs, is there incentive on money saved? You know what I'm saying? Like, if keeping costs down, maybe they look at a projection and say, well, last year this time, this is how much money we spent. This year we're on track to do this. Is there like an incentive in that way?
I think I'll give you an example.
Okay.
If let's say you go into the hospital with needing open heart surgery, and your insurance company says that diagnosis, heart attack, will say you get to spend 5 days in the hospital. If the hospital gets you out before 5 days, the insurance company is still going to pay the hospital 5 days worth of service. But if it takes you 7 days to get out of the hospital still only gets paid for 5 days of service. So these are all the deals that the hospitals have to make with the insurance companies. And what Obamacare has done is give the insurance companies all the clout and all the leverage over the hospitals and the providers, even your regular old doctor's offices, because they determine what they're going to pay for service, and then the providers are kind of at their whim.
Wow.
Yeah,
look,
I mean, it's really gotten bad.
Yeah, it's so when you hear people talking about Obamacare, and I'm hearing a lot of, I know about the rates, I know how crazy that is. Yeah. People paying double, sometimes triple, sometimes more than that, than what they used to pay on their own plan, and it's not because they got more coverage. Jeff, no, it's like, they're just paying more for the same coverage or less coverage. You're right. Because look, a personal story, Jeff, right? I just turned 43. When I went to the doctor, I said, well, let me get a checkup. And you know what? Since you're here, let me go ahead and get my colon checked, man. Because I know for black men, this is an issue. And I'm here, and let's do it. They said, you got to come back when you're 50, homie.
Yeah. Exactly.
Because yeah, like back in the day, you could do that, but they said now you have to come back when you're 50 or older, or you got to pay for it out of pocket because, and I'm like, well, what if I'm 49 and I die from it? They're like, well, if you ever, are you in pain right now? It's like, no. They say, well,
yeah, like, right,
you have to be in pain. And he looked at me, the doctor, I'm not lying, Jeff. The doctor looked at me like I should lie. Like, you know what I'm saying? Like, he was like, are you experiencing any type of pain right now?
And the providers will do that. They'll try to talk to you and steer you in a way of what they think is best for you, because that's the thing, is that the doctors, the nurses, as angry as some patients get, especially in the ER, we are trying to help you, but we are both working against a system that is set up not to help you. So we will try to steer you to say the things that you need to say to get admitted if we really think that that's what you need. Because, we learn what works and what doesn't, and we try to use that not to our advantage to help the patients. But again, like I said, at the end of the day, the roadblock, the hurdle that we have to get over is the insurance companies.
Wow. You got me thinking, Jeff, like I need to go back to the doctor right now because maybe he was trying to tell me something.
I mean, really, if you want to get a colonoscopy, you go into your doctor's office, you said, I've had diarrhea for a couple weeks. My stomach doesn't feel good. Let's get this checked out. And then it'll get done, and they'll be able to file the paperwork, and they'll say, look, his chief complaint is this. He's this age. He's this demographic. I think it's a good idea to do it. But you have to give them something to work with, and most people don't know that.
Yeah, and I hopefully somebody watching this, Jeff, man, look, if we stop right now, you just help somebody. Well,
Yep,
first of all, you help
exactly.
me, but you help somebody else who's going to watch this video, and maybe you never know, man. You being a, you being a medical professional, maybe just saved a life. So give it up for Jeff, man. On that, that's what it's all about.